you may recall I announced a coalition. It was across governments. It involved public and private and nonprofit partners. It's a group committed to delivering a new policy framework for behavioral health in our region. Now, one critical component of that plan, and it would be multifaceted, is residential care. Residential care facilities like this one, known as Cascade Hall. Our behavioral health vision at King County is for everyone to have access to the care they need when and where they need it, especially in moments of crisis. So Cascade Hall is that kind of place. Cascade Hall is a place where people heal, where they get better, where they recover. But places like this and their ability to care for people in King County are in peril. Over the last 4 years, through a combination of funding and workforce challenges, our community has lost nearly 1/3 of our residential treatment capacity. Nearly 1/3, forcing people to wait longer for care when they need it most. Now, what do I mean by wait longer? Well, due to the loss of beds, we've had the time that it takes to get into treatment growing and growing. So now the wait, if you're in crisis and you seek help, is some 44 days. Can you imagine reaching out because you urgently need behavioral health care and being told to wait a month and a half? So clearly that's not acceptable. Our proposal that the coalition will wrap up in just a few weeks will clearly include measures to help not only turn around this continual loss of beds, but in fact grow our capacity to meet the actual need here in King County. But we can't wait for that proposal, and we can't wait for further developments. We have to act now. So today I'm announcing that King County is in the final stages of purchasing Cascade Hall, which in one single transaction will preserve 25% of our remaining beds, treatment beds, in King County, our residential care beds. Now, when we learned this healthcare facility was on the brink of closing, we were obviously alarmed, and we stepped up to help. The Washington State Legislature also stepped in with help. With $6 million from the state and the balance from King County mid funds, this vital resource will remain a place preserving critical mental health treatment capacity in the region. I want to thank Representative Lisa Callan, Senator David Frocht, and Representative Nicole Macri in particular for their support. And of course, none of this would be possible without the hardworking, dedicated staff who provide those in need with the treatment that will help them gain their stability, the stability necessary to better themselves and their lives. I want to extend deep thanks to Cascade Hall's outgoing service provider, Sound, for all they've done to support residential mental health treatment. And I want to thank and welcome the new providers, Community House, who will take over operations at the start of next year and ensure that services remain accessible here in the long term. Now, today's announcement is just one part of a multi-layered solution to turn the tide on losing residential care and begin restoring the behavioral health system that has for decades been undervalued and underfunded and under-resourced. It will take all of us working together to respond to this crisis and to ensure every person in King County has access to the care they need when they need it, now and in the future. And now I'd like to introduce Katrina Enger, the Executive Vice President and Chief Program Officer at Sound.
Hello, good morning. Thank you, Executive Constantine. I'm Katrina Egner with Sound, and I'm here really on behalf of Sound and a number of our colleague agencies today to really thank the county and Community House for coming together and collaborating on the transition for Cascade Hall. Sound has run Cascade Hall for the last 3 years after we joined with Community Psychiatric Clinic. And as you all know, the last 3 years have been incredibly challenging for behavioral health. I've been at Sound for 24 years and have never seen something quite like this. So the crisis in our community, the behavioral health workforce shortage has been unparalleled. And Sound, like many agencies, need to take a moment sometimes and figure out where to best put our resources. And so that is why we're exiting from Cascade Hall. So the long and short of it is I am thrilled to hear about the dedicated resources to both residential and fixing our crisis system. It is necessary and absolutely critical for the people we serve in our community. So again, thank you to Executive Constantine and King County and Community House. And I will now turn it over to Chris Sala, who's the Executive Director for Community House.
Thank you, Katrina. Hi, I'm Chris Sala. I'm the Executive Director of Community House Mental Health Agency here in Seattle. We are pleased to be partnering with the King County Mental Health Division in particular, and with King County in general, on taking over operations of Cascade Hall beginning January 1 of 2023. Our organization has been involved in residential for well over 30 years. We run and have under contract currently with King County 3 facilities that are very similar to Cascade Hall. So we hope to, bring our expertise in and to help with the transition for Cascade Hall. Cascade Hall is sort of important to me because it was actually the first job I ever had in Seattle, Washington, back in 1987. Cascade Hall opened in 1985. So this is a kind of an interesting return for me as executive director. With that, I'm just going to put in a shameless plug to people out there who are interested in the field. We do have a workforce crisis, but I'll be the poster boy for you could start somewhere like here and become an executive director one day. So there is a career pathway here for a lot of people, and I can say, having worked the residential end of things myself, that the people that do this work are very special. It takes a certain talent to be able to be with people in their home 24 hours a day. Very different than outpatient case management, from prescribing meds or doing anything like that. It takes a certain talent, and there are a lot of people that work for us currently, and I know have worked for Cascade Hall for well over 10, 15, 20 years. And that's a real special dedication, and we, really, our hearts are there with you from our organization. We hope the initiatives that King County will be announcing in the next few weeks are going to be extremely helpful to our situation with running residential facilities, as well as the King County system of care in general. And we're excited about hearing about those initiatives here in the next few weeks. And so after that, I would like to introduce King Council member Sarah Perry. Thank you.
Hello. Thank you very much to everyone here with us today, and to those not with us today but who have also made an impact on this moment of progress in an area of critical need throughout our region, behavioral health. For the past 8 months, I've been having extensive conversations with my colleagues, including Councilmember Zahalai, Leo FLOR, KELLI, NOMURA, Kelly Ryder, state legislators. I want to also recognize Manka Dhingra, Senator Dhingra, and Representative Tina Orwell in this process, Lauren Davis. Behavioral health specialists, healthcare centers, fire and police chiefs, sheriffs, tribes, King County Regional Homeless Authority, superintendents, social service organizations, and more, to try to answer 3 specific questions when working with these behavioral health needs. Those 3 questions are: who can we call, who will come, and where to go? We now know who to call. We know that approximately 85% of all calls to 988 and 911 for behavioral health needs will be addressed through that phone call itself. We know who will come. In the 12% of all calls to 988 and 911 where someone is sent to a person in need at their location, the need will be addressed right there by a combination of behavioral health specialists, social workers, firefighters, and police officers as appropriate for the need. The remaining 3% of all calls to 988 and 911 for behavioral health needs will result in one of our loved ones or community members needing to go somewhere with a short-term residential treatment bed that has on-site support help for them at a critical moment in their lives. Unfortunately, we've not had a way to adequately answer this call of where to go. Hundreds, if not thousands, of those in need are turned away. In 2018, we had 355 residential treatment beds. Today, we are down to under 244 beds, losing more every day. While at the same time, we're watching the actual need increase exponentially in these last 3 years with COVID. But today, we can begin to respond. Purchasing Cascade Hall with these 64 residential treatment beds is an exciting and momentous step forward to allow us to answer this unmet call, enabling more of our family members, loved ones, friends, and neighbors to receive the 24-hour care that they need in a safe and supportive environment. So that one of the most difficult moments in their life is met with the help that they need rather than turning it into a catastrophe. I'm deeply grateful for the partnership between King County and our state legislature to purchase Cascade Hall so that many more of our community have the chance to get the help they need and can get back to what they want to do and what we all want for them, living stable, healthy, productive lives. Thank you. And I now like to welcome our executive back to the podium and want to thank him for his incredible support in this area.
Well, thank you, Councilmember Perry. We're going to take questions in just 2 seconds, but I wanted to just maybe make an observation. This is one, I tried to emphasize this earlier, this is one component of a multifaceted system. And this building, which was built with, I think, state funding in the 1980s, was the kind of facility that was supposed to be the replacement for the old large behavioral health hospitals that had fallen out of favor and that were being closed as a matter of policy. And a number of these were stood up then, not nearly enough to meet the need even then, but the capital funding for maintenance had never followed onto the initial construction. So when Sound or other operators are providing service, they're receiving Medicaid reimbursement, for example, or other funding streams that are directed toward the help for that client. But the basic infrastructure money that the state provided was not followed with maintenance money. And so a lot of these are the same age and a lot of them are suffering the same fate. They're no longer sustainable. And so we need a real push here to save the places we have and to create new places in order that we might be able to even begin meeting the need for residential care. That leaves aside other aspects as well. Where can you go in an immediate crisis, for example? What follows your stay here? If you're ready perhaps to move on to other housing, whether it's subsidized or assisted housing, where can you go? Just came from the opening of a major new affordable housing facility at Roosevelt, 600 new units right next to Roosevelt Station. That too is a component of the solution. We have a long way to go, but we are focused this fall on the behavioral health need in our community and working with all of those, including the folks here who have dedicated their lives to meeting it, to figure out where we can close gaps, where we can build on current successes, how we can provide a system that is up to the need of those who are struggling right now in our community. Now, I have a couple of our agency folks here who are probably best suited to answer questions. KELLI NOMURA leads our behavioral health and recovery section, and Leo FLOR is the director of the Department of Community and Human Services. But we would be happy to take whatever questions you might have.
What's the income stream, the funding stream for buying for facilities like that, like this, if that's what you're going to do?
Do you want to try that one?
Thanks, Scott. So the this purchase, as folks mentioned, is a combination of state legislated provided funds as well as King County mid funds. As we look forward, it's clear that we're going to have a different source to make larger investments. The executive's not yet been given the final sort of decision brief on that. He'll make a decision and then make a proposal to the King County Council. And so can't answer the question of what will be there, but what we can say is the need is significant. And it's going to take a significant effort, as the executive mentioned. And so as we take a look at not just stopping the loss of facilities, but beginning to expand and meet the need, we see very clearly that it's not going to be a little bit of money here, a little bit of money there. It's going to be a concerted effort.
Is health through housing type funding stream, like property tax, raising property tax, like on the table? Is it one option you're looking at? Maybe this is a doubt question.
So we don't have a lot of alternatives to property tax as a local government. The state legislature, the state government creates whatever authority local governments have to raise revenue. And we welcome a conversation with our state legislators about better ways to fund these definite needs in our communities. For now, the only real clear option we have is property tax, but I'm not satisfied with that. I think we can do better. And I would remind you, there's an ongoing conversation about comprehensive tax reform in Olympia, and I miss no opportunity to encourage our legislators to dig in and push faster to get us to a fairer tax system.
I had a question for Katrina, I believe, from Sound. Are there any other possibilities of selling off other facilities that Sound owns?
No, that is not at all in our plan right now. One of the reasons why we are exiting this one is so we can focus and resource the other ones that we have. We have a 16-bed facility in Redmond, and then we have a 60-bed, 64-bed down at Keystone. We're keeping those. We're also building a 16-bed enhanced services facility in Auburn, and there's no plan to get out of any of those.
I have a quick question for Kelly. Can you tell us a little bit more about the residential treatment facilities as opposed to evaluation and treatment centers? I heard you guys talking about crisis beds. Is that what we have here? What's the breakdown of what each of these beds do?
Sure. This is known as a residential treatment facility, and so the residents here live here for an extended period of time, and is not a short-term stay. They are able to stay here for a while, and they get all of their behavioral health services here with the dedicated behavioral health staff that work 24/7. So that's very different than an evaluation and treatment facility, which is the facility, we have several of those in King County. Those are the short-term facilities where one will go if they are evaluated by our designated crisis responder to need an involuntary hospital stay. And those stays can have different lengths of stay, but can be fairly short if needed, and then they can stay a little longer. But those are not meant to be residential placements. So for two very different facilities.
What's the average length of stay here?
Right now, I would say, and I would ask Katrina to correct me if I'm wrong, but we have some people that stay a couple of years because while they're here, they're learning skills, they're stabilizing, they're learning how to become more independent, and then they can transition to a different lower level of care. And some people, for some, it takes a little longer to do that. And so it may not be 2 or 3 years, it could be a little longer than that. We like to be able to offer that opportunity because everyone's a little different in what it takes to learn those skills, become more independent, and find the right placement after Cascade Hall.
That was great.
I'm curious, has the county identified any other facilities similar to this? Certainly, if you're waiting 44 days, the idea is to reduce that. So, as you said, this isn't enough. It's a start.
I think maybe Leo, you can speak to not only what the opportunities are, but some opportunities that may have been lost, some beds that have been lost over the course of the last year or so.
Yeah, I think one point to make is that this is in many ways an extraordinary action and circumstance. So to seek on this fast of a timeline legislative support in the amount of $6 million to be able to deploy county resources for several $1 million, and then to have the cooperation between an existing provider and a future provider, it took a lot of things coming together just to preserve these 64 beds. As we look forward, preservation is certainly the minimum standard. We've got to keep other facilities, and we'll be in touch with a lot of our existing facilities so that they don't have to come to the brink of closure in order to gain stabilization. So that's really our goal, is to not get to this point. As for expansion, we don't have enough of these facilities in the community right now. If we are to increase the need, we will need to identify new places, and I think one of the things that the county can do and has committed to is making sure that that's a regional approach, because we need facilities like this in all parts of the county. So we don't have any specific additional buildings that we've identified right now, and if we As we finalize the proposal for the executive and the King County Council, we will begin to identify where we don't have enough service so that we can look for places to put facilities like this. And I want to emphasize something that the executive said. By preserving these 64 beds, fully 1/4 of our existing capacity in the community, we're taking a big step, but future buildings will not be able to be 64 beds at a time. In fact, some of the folks here have written, I think, in a really informative way about the rules that prevent us from building new 60-bed facilities. These are going to be 16 beds at a time, and so progress is going to be hard, slow, and important.
And, you know, can you remind us how many beds we've lost since our peak capacity?
Absolutely. So if we go all the executive asked me just to remind the numbers. So we are a 2.3 million person county. We have more people in King County than 15 of the United States do. In 2018, we had 388 beds in our mental health residential system, what we would call the long-term residential LTR, the highest level of care. Today, we have 266 beds, only because we've been able to preserve this, and we do have indications from another provider that another 16-bed facility is likely to close this year. So if you hear that 244 number, that's where that one comes from. So whether it's 388 or 266, that's for 2.3 million people. It's not enough in the first place. And as we take a look at expanding in 16-bed chunks, if we're, as we're able to do that, you can see that it's going to require concerted effort to make the progress that we need to as a community.
On January 1, on January 1, what will the residents notice? Will there be any changes, or what do you know at this point?
I would really like to actually invite some of our providers, but what I would say is that we're still going to be working together on this, and our goal is continuity of care and stability for the people who are receiving care here right now. I don't know, Chris, if there's anything else you'd want to say to that.
No, the only thing I'd say is that we're already in contact with the local management here at Cascade Hall and are working around with the transition plans. We'll probably have overlap is our plan. We want the residents to get used to any sort of new crew that we might bring in. So it should be a very smooth transition is what we anticipate.
I'm curious, is this at 100% capacity, and is there a waiting list right now? How long is
There
that
is
for?
always a waiting list. Actually, ourselves and Sound and other providers doing some of the residential work have a weekly call in which they're vetting. And I think currently, 70 maybe on the list for waiting for LTR beds from local hospitals, even Western states still, a few from there.
So that's 70 for annual.
That's right. That's correct. That are being vetted. So, the amount of flow through, the average length to stay within our facilities, and I would say it's probably similar to Cascade Hall, is about 2.5 years for people, and then we're able to move them on to other subsidized housing that we have in our particular portfolio, and I know Sound does as well. So, I don't know I know that Sound they're working with people here currently, Katrina. I don't know I would imagine it'll be pretty full, even when we step in.
I'm curious, you had mentioned that you're looking forward to hearing about some of the initiatives that the executive will be announcing this part of the budget. What are some of the suggestions or advice you've given? Because I suspect that you guys have all talked about what the needs are.
You have about an hour? No, I think that the underlying issue is that there has been a lack of funding for behavioral health, particularly with the growth in Metro King County. We're still you build into inflation, and we've lost ground since the 30 years that I've been working in this field. So funding is definitely part of it. The other part, which has been mentioned about crisis system, a lot of these places have been functioning as sort of de facto crisis centers for a lot of clients, and we really need something else. That, to me, makes a big difference in terms of how the workforce reacts. The folks that work here are looking to take somebody on a journey to, recovery, getting better, moving on, becoming more independent, and unfortunately, they've been kind of drawn into dealing with a little bit too much crisis-type work. and that has impacted the workforce for sure. So it's not just payment and salary that people get. It's more holistic, in my opinion. And so the executive and behavioral health division have been working on, and I know that a lot of that stuff is going to be coming out in the next few weeks. I hope. All right. Yeah.
And Chris mentioned folks who are currently at Western State who need to be in a local residential care setting, but we don't have the capacity. That is an example of the kind of problems that are caused by lack of capacity at different points in the system, because we also have some 50 people in the King County Jail who are supposed to be in Western State, but Western State can't take them. Everybody needs, and there are people here probably who need an apartment with a lower level of care because they've become able to operate more independently. But we also have this housing shortage, which is why I mentioned the 600 units that we're opening today. All of this has to work together, and if any part of the system is really inadequate, it gums up the works all around. And so I'm really eager for us to focus on this, what probably has been the most underfunded, most under-resourced component of that entire system. But there's a lot more dependent on this, and I'm really grateful to those who are stepping up to plan with us the next part of our journey in behavioral health treatment. And I think it's going to be exciting when we as a community rally together to deal with the residential care capacity, the crisis capacity, the grave difficulty in recruiting and retaining a qualified workforce, because the reimbursement rates don't allow people to be appropriately compensated for what's a very tough job. All of that has to go together to make our behavioral health system work.
The defunding has of these services over the last decades has also coincided with privatization. Now we have a publicly owned facility, or soon to be publicly owned facility, run by, if I'm correct, that was run by a for-profit and will be run by a for-profit, unless I'm incorrect.
Nonprofit.
So it will be run by a nonprofit. Okay. Do you think there's ever a situation where we will return to publicly owned and operated?
I think that's, so your question is about whether facilities like this or facilities more broadly should be operated by public employees or under contract by nonprofits or perhaps for-profits. And the answer to that is it depends. And that is true across all the work that we do. There are going to be times when our capacity need really demands that we reach out and have a network of organizations. One of the advantages of having a network of organizations is you can have different groups that have better connections to the diverse, varied communities that we serve, that are more culturally competent, that are better trusted by the people we're trying to serve than a government employee. On the other hand, there are times, and we talk about them sometimes, when we say, maybe this is a service that should be brought in-house. I'm not talking about residential care now, I'm just talking more generally. Maybe it makes sense for us to adopt a different model. We are not wedded to any particular model. We're wedded to what works. And if something requires change, could work better if we took a different tack, then we will do it.
I think this facility isn't going to improve the wait times. What it's going to do, well, it will in the sense that they won't be longer.
Yes, that's correct.
Right, and so that's what it's saying. But the bigger picture is there's so much more.
Yes, that 44-day wait time to get a spot will still be until we're able to add capacity. But as I say, there are a lot of different aspects to this, including having places for people to move when they've reached a level of recovery here, and I do think that we as a community have the understanding that this is our collective responsibility. What we don't yet have is the right funding mix, and so we're going to be talking about that as I pull together the findings of this coalition that we've put together. I'm really hopeful that this is something that the whole community will be able to rally behind and make happen.
Do you want to say anything just to the community in general with regard to just the mental health crisis that we see all
Yeah.
around us? I mean, I think, you know, we've been seeing, you know, occupancy rates in downtown Seattle going down and not as bad as Bellevue, et cetera. It just seems like anecdotally, people are just concerned about what they're seeing.
You know, behavioral health, of course, has always been a challenge, and right now it seems to be a greater challenge because of the times in which we're living. We've already had the stresses of an overheated economy where people are being squeezed out of housing. People who are less able to earn a living and keep up are struggling. That creates additional challenges. Then we had 2 years plus of isolation through the pandemic. That has had a well-documented impact on people's mental health and on substance use disorder as well. We know that we have to respond to this, and we have the ability to. We have to respond to this collectively if we're going to be a compassionate community, and we're going to be a community that lives up to its promise that every person will have an opportunity to fulfill their potential and thrive. There is no alternative. Thanks so much. I really appreciate everyone being here today.